When giving birth and going into labor and delivery, sometimes an extra set of eyes and ears can be a good thing.
We like to say we're the angels on their shoulders, just watching over them and their patients and keeping mom and baby safe.
That's Tarynn Appell, Supervisor of Clinical Digital Care for OSF OnCall, and I'm Shelley Dankoff, your host for OSF HealthCare Accelerated. We appreciate you tuning in and remind you to be sure to subscribe, rate, and review wherever you get your podcast. When you're pregnant, it's important to get care during and after your pregnancy to keep you and your baby healthy. OSF OnCall has a variety of programs to help with that, some that give extra support between your regular doctor visits, beginning at 8 weeks of pregnancy all the way through 6 weeks after delivery, postpartum. A newer program is one that monitors the labor and delivery process no matter where you give birth throughout the OSF HealthCare Ministry. Tarynn Appell is the Supervisor of Clinical Digital Care for OSF OnCall, and she is here to tell us all about the Virtual Acute OB program. First of all, let's start kind of at the beginning. Where did the idea for this program come from, and how was the need identified?
Yeah, the idea came about because OSF is always looking into innovation, and healthcare is growing in this area. We are trying to find ways to capture those gaps where there's lack of OB worlds in the different areas, and then just supporting our bedside nurses who do struggle sometimes with staffing crises or just giving their patient 24/7 eyes on them.
Right, because OSF supports, probably half of our ministry supports the more rural populations out there. And if we're being honest, rural healthcare is changing, and that includes the decrease in the number of providers who help when it comes to labor and delivery. Isn't that correct?
Yes, definitely. We're seeing a lot more OB deserts, and OSF is really trying to mend that gap.
So walk me through how this program works. How does somebody get enrolled in it? Or do you even have to enroll? Is it one of those you show up at a facility, an OSF facility, to give birth, and you're part of the program? Yeah,
so as long as you are admitted for labor at this time, you're 36 weeks and above, then you are automatically being part of our care team. So we are watching over your strip, the whole entire labor process, and our nurses are working with your nurses and reaching out to you and them if they have any concerns.
And this is at any OSF healthcare facility where babies are delivered?
Correct.
Now, when you say, this is technology driven, isn't it?
Yes, it does use AI technology to analyze the fetal heart rate tracings. It really looks at the big picture, whereas a nurse comes in and they sometimes only get to see an hour before they start their shift. So this looks at the whole labor experience and starts to identify trends. And then our nurses can communicate those trends with bedside.
Yeah, because let's be honest, sometimes babies decide to show up in about an hour. Sometimes it could be a day or more. It can be a lengthy period of time, can't it?
Yes. Sometimes first-time moms can be induced for 3 to 4 days.
Wow.
Yes.
I luckily never fell into that group, so that was good. But so when you say our nurses, so the OSF OnCall nurses who are monitoring through the Virtual Acute program, where are they based out of, and how do they access that technology to view what's going on in the room, say in a Mendota or in somewhere else throughout central Illinois?
Currently, our nurses, there's a main hub in Peoria at the OnCall building. They have 3 stations where they monitor, and then we also have a small little hub up at Little Company in Chicago area where we have a couple nurses that work from there. So it's really cool. They have 3 screens. One screen has the hub board that we call. That is how they view the trends, the cues, and then they have a screen for Epic and then a screen to pull up the tracing, which is really great.
When you first launched this, everything is a learning process. We all know that. You can put it on paper and then you go, okay, what's the reality? At a certain point, you launch into the reality and here you go. When we first piloted it, tell me about that. What was that like for both the bedside nurses and then the monitoring nurses? Walk me through that.
Yeah, there was definitely some worry about what this would look like. People were afraid that they might be told what to do, and that's definitely not what our nurses are here to do. It started off, our nurses were just very careful about how they worded things, and really we emphasized that we are the care team with them. Bedside has given us great feedback. They've started utilizing us for breaks if their nurses are unable to do breaks. They have also reached out to us to review tracings with them, which has been huge because, like you said, there are those deserts that don't have OB staff 24/7, meaning physicians or residents. And before they call those doctors, they reach out to us and say, this is what I'm seeing. Are you seeing the same thing? Should I call the OB? And we've been able to give that feedback to them right then and there.
So that way, the doctor or the person doing the delivery isn't standing around. Because again, we all know how, babies sometimes have their own mind and when they're going to show up and move things along. So what are some of the comments that you're hearing from, particularly the bedside nurses? You touched on a few of them, but do they have any stories from some of the moms out there that you can share about what it's been like for the people giving birth?
Thankfully, we don't have any contact with the patients themselves, so that helps. There's no video camera. We can't see inside of the room. So a lot of our calls are just because we can't see real-time documentation in the moment. And so we reach out to bedside just to make sure that position changes are happening, doctors are aware. And most of the time the nurse says, yes, we've been doing this. We just haven't had time to throw in a note, but this is the plan. And then we get a full care plan update, which is great.
When you launched it to where you are now, was it, everybody has expectations when it launches, and then the reality, and you get into it down the road. Has the reality been what you'd hoped for and continues to improve?
Yeah, I would say it's better than what I thought. Our nurses have gotten great feedback about just being helpful and wanting to help the bedside relieve some stress. And bedside shares with us in leader rounding or leader meetings that it's not what they thought. It wasn't us calling every time there was a deceleration. And so it's been a breath of fresh air, I think, for both sides.
Because you let the bedside nurses do their thing. You were just there as that backup, right?
Absolutely. We like to say we're the angels on their shoulders, just watching over them and their patients and keeping mom and baby safe.
So is that the message you give to anybody who might be listening to or watching this that says, wait, what's this program about? And here's people talking about it, because sometimes it can sound a little bit out there. What do you mean you're monitoring me giving birth and you're 2 hours away? Is that your message?
Yes, we want moms to know that they're safe in our care, and that even though their nurse isn't at the bedside with them at that moment, they are always being kept close and watched by nurses across the ministry.
Anything else I haven't touched on about this program that you think is important for people to know?
Yes, we are hoping for some expansion in later of 2026. We are hoping to expand to 32 weeks or above, and also expanding into triage for all across the ministry. This would capture those 36 and above that are there that might be in labor, might not. And we can just really take that load off of the bedside nurse while they could potentially have 6 patients at a time. So we're excited for that growth in our department.
Yeah, I imagine there's a number of women who come into triage, especially first-time moms. Am I in labor? Am I not in labor? Everybody goes through that because you don't know. You've never done it before. So I imagine relieving some of that stress would be a huge thing on the triage nurses, wouldn't it?
Yes, we're really hoping that they see the value as well. And we've gotten a lot of feedback about how helpful it would be in triage as well. So looking forward to that.
Well, Tarynn Appell, thank you so much for stopping by to talk about the Virtual Acute OB Monitoring Program through OSF OnCall. And thank you for stopping by as well. Remember, you can catch all of the OSF HealthCare Accelerated podcasts at osfhealthcare.org/accelerated.